let's talk about patients with hypothyroidism,
Yeah.
thyroid patients. Why is it difficult for them to lose weight?
Yeah. The hypothyroidism makes your whole system slow. So the TSH, if you really see the blood levels, the TSHs should be around 5.
That is the thyroid stimulating
Hormone. If the TSH is 10, 15, this is hypothyroidism.
Can you just educate the audience on the difference as well?
Yeah.
If it is high, it means you have low thyroid.
So what happens is, the TSH level indicates your hypothyroidism or hypothyroidism. It is reverse. If it is hyperthyroidism, the TSH will be low. If it is hypothyroidism, TSH is high. This TSH, what happens, thyroid stimulating hormone, that will basically unbinded thyroid hormone is low. So what happens, it makes the whole system slow. Even the metabolism goes slow. Okay, you're sleep deprived, you're depressed, your reflexes become slow, you react slow. For example, someone calls you, react slowly. The similar way. The hypothyroidism is like this. It will make the whole system slow, including your metabolism. So in hypothyroidism, people may not be knowing their hypothyroidism. They keep put on weight. Suddenly they go to the physician checks your thyroid, then they will say you have hypothyroidism. So this is the reason. So what happens is, if you're getting obese, it's better to get your thyroid get checked. So at least you know that thyroid may not be the reason for it.
Tell me a patient's experience with thyroid and weight loss and bariatric surgery that you have seen.
So many. Most of the young girls who come to us, they always come with a deadly combination of PCOD, the PCOS, cyst in the ovary, and hypothyroidism. So both this deadly combination will make the system very, very slow.
Young is what, like 20, 25?
Yeah, very commonly. So even 13-year-old girl will come, 16-year, 19-year, 25, 30, marriage age. Some girls will come, marriage is an issue.
So they'll come to you because of the weight gain and marriage is an issue.
One more is the patient is not menstruating for years together. Because of heavy weights, they're not menstruating for 6 months, 7 months. They go to the gynecologist, they get some temporary progesterone tablet, get the temporary menses kind of thing, spotting and all this stuff. Again, they are not menstruating.
Can you educate the audience again? I'm so sorry to interrupt. I'm just trying to get into the layman terms.
Correct.
So when there is lack of menstruation for irregular periods,
either heavy menses or no menses. Many of the times there is no menses. They are not menstruating for 3 months, 6 months in a stretch. Understand it? Again they menstruate. Again they not menstruate for a few months. That is called irregular cycles. What menstrual cycles. And this kind of patients, they keep put on a lot of weight. And the hypothyroid hormone also slows down the system. So these girls, I can say, even though they are not eating, they put on a lot of weight. The BMR goes low. So that's how they put on a lot of weight in hypothyroidism and PCOS.
I've seen many patients, in my, that lifestyle medicine clinic called New Me, where people come with hypothyroidism. They do everything right. They eat properly, 800, 900 calories, they work out. I feel very bad for them because they need to do 2 times the effort than the normal person.
See, everyone should know it is not only the person who has to be blamed. Sometimes it is internal system which has to be blamed. See, if your hormones are not correct, even if you're following the strict discipline diet may not work. The parents should be thinking this girl doesn't listen anything, this person doesn't follow. Nothing like that. Some things are not in their control, which making them put on weight. So not every time the person has to be blamed. There's so many things. For example, one person came, his parents, his mother, father, paternal, maternal, everyone is obese. So what happens is this guy is putting on weight even though he's strictly following. Because genetics is very strong. It is not the boy who has to be blamed, it's genetics which has to be blamed.
So genetics just play a role?
Yeah, very strong. Very strong.
How many percentage you will say?
I don't know, but many of the patients, what happens is I see their parents, one of the parents is obese. Or the grandparents is obese. Their aunts are obese. Obesity would have come in their family.
So they
if both the parents are obese, there's very, very high chance this boy is going to be obese. Or girl.
Is it because of the environment or is it because of the genes?
Genes play a very major role. Even I said, the genetics plays a role in getting down the BMR down.
In your patient, when they come for bariatric surgery, their parents are obese most of the times?
Yes. See, that is the reason my clinic is designed in that way. I learned something from Taiwan. So where my clinic has sofas. They don't have chairs.
Sofa, okay.
So many sofas are there. Why I made sofas is there is a logical thinking behind it. Say when a person is obese, most of the family people are obese. So no one can fit into chairs. So the sofas are made to make them sit comfortably. Understand, right? For example, a surgical discussion. For example, for a medication, you got a fever, you can go alone to a physician, get it, write it down. If you want to take a surgical decision, the whole family has to accompany you.
Correct.
Everyone's green signal should be there to go to surgery. I see, for example, 3 members in the family, most of them are obese. Parents are obese. May not to the extent that baby is obese, but still, they're obese. So in that way, most of them are obese. So that's the reason the sofas are made for them. And the room should be bigger one because, and I show them in the projector. So what happens is, it's easy for them
To see.
because when you see it, you will understand it. If I draw anything, it will not be visible.
And in these patients, the hypothyroid, PCOS patients, after bariatric surgery, they get better?
Yeah, PCOD does amazing. What happens is the menses gets into regular shape within 6 months. The PCOS physical, what happens is there is a physiological change and an anatomical change. First physiological change happens because the main treatment for PCOS is weight loss. You go to any doctor, the treatment is PCOS is weight loss. So within 6 months the menses get better. What happened? They used to get a lot of hair everywhere. That will reduce, and the hoarseness of voice comes down. And wherever you felt like it's difficult to lose weight, they would have lost from the hips. Very difficult area to lose weight. They would have lost weight from there.
IVF outcomes?
Yes, very good. Post surgery, what happens is IVF. There's people who are not conceived with IVF also get conceived. If there is no anatomical problem in the uterus, if PCOD is the only problem, they get conceived.
So PCOS patients should consider surgical intervention.
They can consider if they are morbidly obese. If nothing is working for them, then definitely they should consider. But the only thing is, they have to conceive. They have to give a gap of 1 year at least between
After
surgery and conceiving.
I see. And you have successful patient outcomes.
Yes, lot of n number of patients.
How many patients do you see in a day? And new patients?
New patients, around 4 to 5 obese patients I see.
4 to 5.
Yeah.
Out of this, is it male or female majority?
I should say 60-40. 60 is female, 40 is male.
60 is female. Why is it very common in women? You think it's because of hormonal imbalance?
I think hormonal imbalance is one of the things. And in women, what happens is, I don't know what is the thing, the cravings are more than men. I always see that. Women cravings are more than men. For example, for the chocolate, for the bakery item, the men crave less than women. That I feel like that. And PCOD, hypothyroidism, one of the reasons. And what happens is,
I feel like
the fat accumulation is very easy for them. The reason is, they have less muscle. They have a lot of space to accumulate fat. The muscle, anti-rectus abdominal muscle, is less in women compared to men. That's the reason the stretching happens in pregnancy and all. So what happens is, a lot of people accumulate fat.
And I also feel like the sleep may be less.
Is it?
In women.
Oh, is that okay?
In general, because of, I feel like,
maybe
they are the main person taking care of everybody in the family.
Correct.
And as you said, lack of sleep.
Yeah.
There was a study when they said that if you sleep only 4 to 5 hours, there is a 22% increased risk of obesity.
Correct. I agree with it. I completely agree with it. Sleep is the only time your body repairs. If you're not giving the time to repair, definitely it's going to be unrepaired. That will carry forward.